Signs of veins and discoloration to painful symptoms like swelling and achiness. Varicose veins are more than just a cosmetic issue.
That's right. Vascular surgeon with UT Physicians and associate professor at McGovern Medical School, Dr. Stuart Harlin, is joining us now to walk us through varicose veins 101. Doctor, welcome to the show.
Thank you for having me.
First of all, let's talk about what varicose veins actually are, because it sounds like there's a lot of misinformation out there.
Sure, I mean, they're really a spectrum of disease, and they go from little bitty tiny spider veins that have really no clinical significance other than you just don't like the way they look, to, great big, veins the size of your thumb that can cause real medical problems.
And basically, this is not just women. This is men, women. Is there an age where we can?
It's really half the adult population in the United States, and they certainly become more prevalent as you age just from standing up all your life. But they affect the whole population.
And another thing, kind of what I'm doing, is this wrong? Crossing our legs, right?
No, not at all.
Oh, no, it doesn't cause varicose veins.
It really does.
Oh, wow.
That's a myth, right?
An old wives' tale.
It really is.
Okay.
Doctor, okay, so you touched on the fact that they are not just cosmetic. They can cause some serious medical problems. So what kind of problems?
Well, an article came out just a couple of months ago, actually detailed a risk factor of varicose veins causing actual blood clots like DVTs and pulmonary emboli. So those are potentially fatal problems. I think the things we think of more frequently are people who get these brownish discolorations down by their ankles and get sores there. They're very difficult to eradicate. And those are very prevalent, and they cause really bad long-term symptoms.
Yeah. And so this is basically the graphic that we're looking at here. Walk us through this, because this is talking about the blood flow and how it gets blocked.
Sure. So venous circulation is supposed to go just by gravity. And every inch or so in your veins are these little valves that are supposed to close when the limb hangs down. When you get varicose veins, those valves fail, whether it's from childbirth or standing on your feet too long or whatever that is. And then just by gravity, it's easier for blood to go downhill rather than uphill back towards your heart.
Okay.
And gravity takes over.
Yeah.
Is it true that women are more likely to have varicose veins, or is that also a myth?
No, because of childbirth, women are more likely to have it, but men have a very significant risk as well.
And in addition to childbirth, are there other things, other reasons why people would develop varicose veins? Essentially, I guess I'm asking, how can we avoid developing them, or is it just inevitable? Is it genetic?
There's a very specific genetic component to it, and clearly if your parents have it, or your aunts and uncles have varicose veins, your likelihood is significantly higher as well. But obesity has a little bit, but not as much as people think. Certainly childbirth, and then just the human condition, standing up all your life on hard floors.
Yeah, that's one thing we need to pay attention to that. So when we have them, I guess there's symptoms that are associated with this. So maybe we don't like the cosmetic side. When is it the time that we really need to go see you? When
you start really having symptoms, I mean symptoms like swelling that doesn't go away, discoloration, pain, achiness, or maybe signs of phlebitis where you get a vein that's lumpy and hard that doesn't go away. Right. So those would be clear indications that it's something other than just a little cosmetic problem.
And what would happen, let's say someone, doctor, comes to see you, sort of walk us through the process of how this would be identified, because I understand there are all different ways of diagnosing, like you can inject dye into someone's body.
Sure. But most of the time it's going to be just as we're talking about history and physical, what's going on, what symptoms they're having. Then after a simple physical exam, look at the veins, where they are, how big they are. If they have other signs from that swelling, discoloration, stuff like that down by their ankles. The principal imaging is now ultrasound. And so no radiation, no contrast for 80 or 90% of the venous studies. We occasionally have to use contrast if we think patients have a problem higher up inside their abdomen or pelvis, but really that's the overwhelming minority of patients.
Oh, so it's a non-invasive, if someone's getting an ultrasound on their legs, I mean, that's a painless process,
yes,
right?
Exactly, absolutely.
And from that point then, how do you move forward either to remove them or to stop them from getting worse?
The principles of therapy are the common sense things everybody does now. You exercise, you stay in shape, maintain your weight as you can, elevate your legs when you're at the end of the day, compression stockings, simple things really help. Once you're past that, once you can have symptoms despite all those things, then we get into interventions.
And Dr. Harlin, we're seeing some of these lifestyle changes. We just saw them just now on the screen. Is that really the first step for you in advising your patients that they need to just make an adjustment? Because I understand a lot of doctors are very conservative when it comes to treating.
Absolutely. No, those therapies clearly help, and they help a very large majority of patients. So certainly before we consider intervention of any kind, basic things, elevate, compression, exercise, all those things really help control symptoms.
And even compression socks, I mean, I know my husband wears them a lot when he travels. And what about if we run a lot? Is that just more of a prevention if we don't have them now?
I think it's probably a great idea, and we advise our patients who exercise, go to Dick's or Academy or wherever you shop, get some of the athletic, compression things. They truly help.
Okay.
Yeah, my sister wore those after her babies were born. Okay, so Dr. Harlin, I understand you guys have an online tool where, in case viewers out there are wondering, hey, is this me? Does this apply to my scenario? But people can go to your website essentially and just respond to a questionnaire.
Absolutely. On the UT website, there's a section called www.texasveinscreening.com. So it's online, it's free, it's completely HIPAA compliant, completely confidential. You answer a few questions like, do my legs swell, are they the wrong color, those kind of things. You take a selfie of your leg and you send it in. And so it's basically a virtual office visit.
That's fantastic.
So it's certainly absolutely free. I read them all. We read them as soon as they come in. And we'll tell you if it's something just maybe a little cosmetic problem, or maybe it's something that's a little bit more serious and you ought to consider getting someone to look at.
And there is a shop, by the way, of that website, HoustonVeinscreening.com, where people can go in and answer those questions. Doctor, thanks so much for coming in, because I think a lot of folks need to be aware that this is something they don't have to live with every single day.
Absolutely not.
Okay.
Thanks so much
for stopping by. And if you would like more information on UT Physicians, you can call 888-4UT-DOCS, or you can log on to utphysicians.com. Thanks again, Doctor.
Okay. Thank you so much for having me.
Thank you.
Thank you.
Absolutely. All right, coming up next, keeping a close watch on our aging parents. It's natural and necessary, but hovering too closely can cause some problems.